Assalamualaikum warahmatullahi wabarakatuh, and good morning, ladies and gentlemen. Very warm welcome to all of you joining us today's webinar, Driving Laboratory Excellence, the Strategic Role of Management System in the Standard Adherence. This session is dedicated to one of the most crucial aspects of laboratory operations, ensuring quality, reliability, and compliance through effective management systems. It is my absolute honor to introduce our distinguished speaker, Wan Fariza binti Wan Abdullah, a leading authority in laboratory accreditation and quality assurance. Wan Fariza is the head of the medical testing, PHLAS and GLP section at the Accreditation Division, Department of Standard Malaysia, DSM, MITI. She holds a diploma in science from ITM, a Bachelor of Science in Biotechnology Resource from UNIMAS, and a Master of Science in Health Science, Biomedical Science from UKM. Since 2009, she has been a lead assessor for MS ISO IEC 17025, 17043, 15189, MS 2720, and OECD GLP, conducting nearly 200 assessments. In 2012, she was appointed as an Asia Pacific Accreditation Cooperation APAC evaluator, assessing over 17 accreditation bodies worldwide. She was also the first Malaysian trained in ISO 15189 by APLAC in 2004, and her contribution has been instrumental in accreditation scheme for forensic science, household pesticide, nucleic acid, GMO analysis, medical testing, primary healthcare, and non-clinical safety studies. Beyond assessment, Wan Fariza is a highly sought-after trainer, having conducted extensive training sessions in Malaysia, Saudi Arabia, UAE, APAC countries, Poland, India, South Africa, Thailand, Taiwan, and Brunei. Since 2011, she has also represented Malaysia as a member of ISO TC 212 and working partly on OECD GLP. Well, quite a mouthful biography there, and I think it's a very incredibly impressive one. I think if you're working in a lab, you should know her because she is actually the one that defined the procedure and ethical guidelines that we follow every day. With that, I think I've been talking too much here. Without further delay, please join me in welcoming Puan Fariza binti Wan Abdullah. Over to you, Puan Fariza.
Assalamualaikum warahmatullahi wabarakatuh, and a very good morning. Salam Ramadan Kareem to all the Muslims. I could see many from Indonesia also, and I've also extended this session to friends in Brunei, in Thailand, in Vietnam, and Philippines. If they are available, they will also be joining this session. So Secretariat, just take note on that. So Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Allahumma salli ala Sayyidina Muhammad wa ala ali Muhammad. Rabbi israh li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Amin. Thank you very much to PPSM, which is Persatuan Pegawai Sains Malaysia, for giving me this opportunity to share with you a bit of experience related to laboratory management system that I have been involved in since 2002 until now. And allow me to share my screen here. Kenapa dia tak berjalan? The cursor is not moving. My apology. Let me just try again. Okay. Okay, so we'll start with my first slide here. Hold on now. There's a bit of glitch. Okay. Let me just minimize this. All right. So I don't see. All right. Okay. So this is the title given, Driving Laboratory Excellence. And I believe for you to be an excellent lab, you must have a system in place. And here I will share with you some of the management system that can be adhered to laboratories. So the strategies, role of management system in standards adherence. So thank you again to PPSM and also the PPSM International Scientific Webinar Committee for giving me this opportunity to be with you in 1 hour. So my name is Fariza Wan Abdullah, and a scientific officer in Accreditation. Okay, and I'm working with the Department of Standards Malaysia. It's an accreditation body in Malaysia, and we are under the Ministry of Investment, Trade and Industry. Okay, so the presentation outline consists of five areas, which I will start with the definition of what management system is, what are laboratories that we have, okay, types of laboratories, management system for laboratories, and also organization that develop the management system standards. Okay? And finally would be the conclusion. All right, so based on definition, and this definition is taken in general, and I have actually amended what I've seen from the definition based on my experience. So what I'm going to share with you here is mainly based on my experience and on my personal perspective. Okay, so if I'm going to, sorry, what is going on? Kenapa dia shut down? Okay. All right, so where were we just now? Okay, we are here. Based on definition, okay, so this definition is a combination of a general definition and based on my experience in dealing with laboratories management system. So I would say that a management system for laboratory is a structured framework, that ensure laboratory operation meets or comply with the regulatory authority, technical or customer requirement. So the operation here complies depends on the purpose of the laboratory. So some laboratories comply with certain technical regulation because that is the requirement of the regulator. Some lab will comply based on the standards requirement because that is an accreditation requirement. So based on this compliance, it will actually go through a standardized process, quality assurance, making sure the quality assurance, consistent operation, and continuous improvement. So mainly, I would say that this is the main objective. Why are we complying to the regulation, to the technical specification or customer requirement? Okay, where else? What is lab? So a lab or a test facility is where a scientific activities or a research or experiment or a measurement or a testing or a studies that are conducted to ensure accuracy, reliability, and compliance with the established standards that has been selected. Okay, so some standards that has been selected for different purpose. So that's where the system makes difference, which we will learn after this. with established standards under a controlled environment. So a controlled environment here, not only meaning that we are controlling temperature and humidity, but we are also controlling the access, yeah, the competency of people, the safety, and etc. So you have to understand the definition of laboratory here in a more bigger perspective. All right. So in terms of types of lab, yeah, if I were to ask you to list down what are types of labs, so hundreds of it, yeah, you can list down. But here I try to list a few, which is the normal, which we could see. Yeah. So these are among the types of laboratory that we usually have under the accreditation, and sometimes also under the regulatory requirement. Yeah. So these are example of laboratories. So based on this type of laboratories, sorry, I've forgotten to put on the alarm so that we are on time. Thank you. So based on this type of laboratory or test facilities that we can find, I would like to categorize this laboratory into three. Yeah? So this is my definition. So you might have more than three, but this is the three that I would like to share based on my experience managing, handling, and conducting assessment for laboratories. So I would like to categorize the first type is the commercial lab that might be handling or doing the calibration activities, chemical testing, veterinary testing. Veterinary can be drugs, can be the veterinary samples, a halal lab, pharmaceutical lab, QA, QC lab, animal, meteorological, entomology, bioefficacy, and molecular, and etc. So this is the first categorization of lab which I categorize. And second, yeah, we have one more there. E&E is the electrical and electronic, yeah, mechanical and physical lab. And then we have the second type is the R&D lab, which I divide into two, clinical and also non-clinical lab. And then we have special lab, yeah, which has very specific function. So I list down here three special lab, which is the proficiency lab, reference lab, or the metrological lab. Okay. So based on this categorization, then we will look into what are the management system that is being used in this type or category of laboratories. Okay. So as mentioned just now, for commercial lab, as we can see, these are the commercial lab that we usually have. So the aim and purpose is very wide. Yeah? As you can see here, this is only some example, which can be more. Yeah? Can be more. Let me just pull this out again. It's disturbing me where I have all the system check. And so okay, satu saja. Okay. All right. So wait. Okay, so this is the aim and purpose of the lab. So the lab can be a routine lab that is doing any types of testing. It can be QA, QC testing. It can be determination and screening purpose, confirmation of certain specification, confirmation of ingredient, food level, microorganism, or diagnosis lab for diseases, physical, chemical specification, and E&E specification. So these are some of the aim and purpose of the commercial lab or the routine lab, I would say, that is running, yeah, with such purpose among the listed types of lab that I have here. Okay, And next would be the sample that will be tested. Usually, this is also some examples only, which I list down here, like food sample, environmental sample, water sample, animal, human sample, electrical, soil, concrete, and etc. So these are among the samples that usually will be used in this type of laboratory. Just pointer. And what is the system? What is the management system used by this type of lab? So it could be referring to MS, which Malaysian standard, or since we have Indonesia here, you have also, I think, adopted the ISO 17025 into BSI, if I'm not mistaken. Okay, and also 15189, ISO 15189. So if we can summarize this, so these types of lab can be divided to another two, which is non-human and human. So any testing that is done for non-human, it will be usually under 17025, and the human sample will be run under 15189. So this is the standard that usually been referred by laboratory under accreditation. Okay, but for a new lab that has yet to be accredited, they can actually use these two standards to their management system in terms of their daily operation. And when they have that confidence to be accredited, then they come forward to the accreditation body. Okay, so if you look into this standard, it is written in the introduction that you can use both standards for a normal operation or to be recognized by an accreditation body. So, so this is the standards that can be used by a commercial lab, either using human sample or non-human. Okay, because I could also see in the list of participants, they are medical lab based and they are also non-medical labs. So this would be common to you, which I'm sharing here again. And the second type or category of lab that I would like to share with you is a lab that is conducting R&D for human sample, or we call a non-clinical lab. Usually it's run on non-human sample, which can be the animals. It can be fish, it can be aquatic animal, Daphnia, algae. It can be also the rats, the rodent, the rabbits, dogs, even primates, and it can also be microorganism now. So this type of lab that is running the non-clinical activities, they are usually running studies that we usually call it as a safety studies on human health and environmental protection purposes. Okay, so this type of lab will run studies that is related to example toxicology studies, ecotoxicology, biodegradation studies, residue studies, and we have a lot more. So this type of lab will be referring to the OECD, which is the Organization for Economic Cooperation and Development, Good Laboratory Practice, or in short, we call OECD GLP document number 1. Okay, so whoever that's running these safety studies, they are not only referring to GLP document number 1, but they are also referring to OECD test guideline, the TGs, as a protocol to run these studies. Okay, and the purpose of this is to determine the safety aspect, of a product. So under GLP, there are 8 products that's been listed, which are pharmaceutical, cosmetic, vet drug, industrial chemical, pesticide, what else? Feed additive, food additive, yeah, and yeah. So that is the common product that is being used, yeah, as a test item to run the safety studies, yeah, on the non-human, on the animal, aquatic organism, and etc. Okay, so the result of this is a safety data sheet. Okay, next is an R&D lab that is running a clinical, is a clinical lab which is running human sample. Okay, and the performance of this clinical trial, yeah, could be among the using biological samples, which can be serum, yeah, a plasma, or yeah, and pharmacokinetic studies and safety assessment studies also, yeah, but is focusing on human sample, where usually this will be run to ensure, for example, the effectiveness or the efficacy of drugs, yeah, on human subject, yeah, whether they are a normal subject or they are patient, yeah, to the subject. So usually for this type of R&D, there are a very strict ethical conduct and also consent, yeah, by the subject who wish to be part of this clinical studies. Okay, so the reference that we use is the ICH, yeah, good clinical practice, or in short GCP. Yeah, I will further share with you all this acronym. And the last type is the special lab, right? So first type would be the proficiency testing lab, or in medical, we call the EQA, the quality, external quality assurance, a program lab who is running. Either it can be a non-human or human sample, yeah, that will be distributed around to the participants and to see the performance of the lab. Yeah, how is the performance of the lab by the results that's been submitted by the participants. So it would be good that this PT lab or EQA lab, yeah, when they run the function, okay, and they are running as to perform as a PT or EQA provider, they are using the ISO IEC 1743. Okay, so this is standard that will be used by this special lab. Okay, and the second type of lab is a reference material lab that produce non-human and human sample a reference material. Okay, so this is also a specific lab, and usually this type of lab is a very high and conducive, yeah, control environmental in terms of environment, yeah, of the lab. And the function is to perform and produce the reference material, yeah, as a reference material producer. So it can be producing a non-human, for example, a certain specific chemical, and for human, for example, glucose reference material, cholesterol, and etc. Okay, so this type of lab will be using the ISO IEC 17034. And the last special lab is the metrology lab, yeah, that they are actually looking after or making sure that the artifact, yeah, for example, I take here the physical artifact like standard weight, standard length, standard thermometers that is being used to calibrate, yeah, the weight, the weight or the thermometer that is sent from their customer, okay, to align or to comply with the standard weight, standard length, or standard thermometer that is being kept in this metrological lab. So usually this type of lab is a reference lab, yeah, for the metrological measurement. And sorry. and they usually will be referring to the OIML and BIPM. So we will learn about this later. Okay, so these are the next part of the sharing is the organization that's involved in development of this management standards for laboratory. So the first one I would like to share with you is the ISO. Okay, so the International Organization for Standardization, or in short, we call ISO, is an independent non-governmental organization that develops and publishes international standards to ensure quality, safety, efficiency, and also interoperable across various industries worldwide. So ISO has a lot of reference that's been used, standards that been used worldwide for all type of sectors. Yeah? The standards that's related with conformity assessment body, like laboratories, inspection bodies, or calibration lab, testing lab, medical lab, they are under the, they are under the purview of ISO CASCO, which is a Committee on Conformity Assessment. So any standards that's established that's related to conformity assessment activities, it will be looked under the CASCO, ISO CASCO. It is a policy development committee within the ISO. Its primary function is to develop standards and policy document related to conformity assessment, which ensure that product, service, system, and personnel meet the specified requirement. So all the standards that I share with you with the title of ISO that's used by under the accreditation is under the purview of ISO CASCO. Okay, and usually ISO CASCO will define three elements, which is competency, quality, and consistent operation. Okay, and besides that, the important element that will be put into is impartiality, confidentiality, and what's the other one? I can't remember now. Okay, so so this is the function, yeah, of ISO CASCO. So if you could read this through, is a lot of things that's related to conformity assessment, including technical barriers to trade. Yeah, in short, we call TBT. Okay, so they will look into seriously, yeah, in terms of the requirement that is been fixed into the standards, and making sure the vocabulary that's used in these conformity standards are referring to the 17,000 standards. Okay, and this is also to comply with consumer and regulatory confidence, yeah, ensuring, yeah. So this is the function of ISO CASCO. And these are the example of standards which I think you are aware of. Yeah, so I picked this from international because not MS, because I know we have international participants. So you will see this is the format of ISO for conformity assessment standards that will start with scope, normative reference, and terms and definition. And then it will be continued with the clauses that is needs to be complied with the laboratories, clause 4, 5, 6, 7, and 8. Okay, so this is 17025, and this would be 43, yeah, 1743 for the proficiency testing provider. So again, you will see the same structure. So these are all complying to the ISO CASCO. Okay. And this is 1734 for the reference material producer. So I just had attended this training, yeah, early March, yeah, early February, yeah, to learn how this process is taken in place. So it's really different from normal routine lab. So that's why I categorize this under the special lab. Okay, and this is 15189, and you can see more wordings. Okay, more wordings that's been put in as compared to 17025 or 43 or 34, because 15189 is looking into patient care. So there's a lot of issues that is been put in, requirement that's been put in that is related to the patient care. So you will see a lot more wordings as compared to the other standards. Okay. And the next one is, oh, I've lost one slide. Where is that slide? Okay, all right. Okay, so the next one would be the OECD, which is the Organization for Economic Cooperation and Development. It's an international organization that works to promote policies aimed at improving economic and social well-being worldwide. So under the OECD, there are 36 member countries, and there are 7 non-member countries that adhere to the OECD framework. Okay, so what is the function of this OECD? As you can see here, they're also involved in policy of R&D, setting international standards. Okay, for example, anti-corruption, corporate governance, and also oversees the OECD principle corporate governance and multi-enterprise. And later you will only see that putting trade investment and also conformity of good laboratory practice, okay, that oversees this lab. So this is the one that is the standards that we use in non-clinical R&D lab. Okay, and besides also they are monitoring and assessing the economic trends. So there are a lot of functions under OECD, and one of it is monitoring and looking after the safety aspect, yeah, of data integrity, safety data, sorry. Okay. And this is the standards that's been used, or this is what we call OECD document number 1. And you could see here, these are the requirements that starts from number 1 until number 10, okay? Whereas the section 1 here is more on the terms and definition. So for a safety or non-clinical lab, so this would be the requirements that needs to be complied. And the next one is ICH, the International Council of Harmonization of Technical Requirement for Pharmaceutical for Human Use, that develops the GCP, Good Clinical Practice, is a guideline to ensure ethical and scientific quality standards that involve designing, conducting, recording, and also reporting the clinical trial. So as I mentioned to you earlier, because this involves human, so that's why it's very strict onto the ethical conduct. Okay, so ICH GCP is crucial for regulatory compliance, ethical research, and global acceptance of clinical trial. Okay, later you will see that it's been monitored under the regulatory. Okay, so this is the function of the ICH GCP. So as you can see here, ensuring ethical standardization, clinical trial procedures, facilitating the global regulatory acceptance. So which means if a clinical trial is run under the ICH GCP, is well understood. It's a system that's been recognized. And you can see here it's used for harmonization between Europe, US, Japan, and other regions, and mutual acceptance of clinical data. So it's very important here. And the rest of it, as you can see, everywhere we have to ensure that whatever we do, integrity of data and reliability is one of the important element also. Okay, guiding the sponsors, investigators who are involved in the study. Yeah, so these standards will actually put down the requirements, the responsibility of whoever that's involved in the clinical studies, and also supporting the drug development. Okay, and this is the document, the ICHGCP. Yeah, so if you are running the clinical trial, this would be the best reference, yeah, to be used in your laboratory. So here you can see it has been defined. What are the principles, the review board on ethical, which is the most crucial, yeah, element, yeah. Who are the investigators who are involved in sponsoring these studies, and then the clinical trial protocol, what sort of method has been used, and brochures, and finally it will be the essential document. So these are the management system for clinical trial laboratories. And finally is this is the OIML, the International Organization for Legal Metrology. Okay, so it's also an governmental organization that developed international standards and guidelines for legal metrology, yeah, in the field of concern in accuracy, reliability, measurement, use in trade, health, safety, and environment. So this legal metrology not only for normal measurement, but it's also looking into trade, yeah, what are the ISO units that's been used, yeah, in health, yeah, in safety, environment protection. So these are some of the reference, the common reference that's been used under the OIML. However, I would like to show you one here where all the National Metrology Institute, yeah, worldwide is referring to these standards, making sure that they have a proper system which help the country to establish and improve their metrology, their national metrology system. Okay, so it's provide a framework for drafting national metrology laws, ensuring consistency, reliability, and also compliance with the international best practice. Okay, so in Malaysia we have a National Meteorology Institute of Malaysia, which is in short we call NMIM, yeah, that is having this function, yeah, for the country. Okay, so as a conclusion, so I will just draw out, yeah, for easy understanding with what I have shared with you. So based on the laboratory activities just now, we have 3, but here I put 2 first, which is a routine testing and also the R&D. And I divide this into non-human and human, non-human and human and non-human. So these are the standards that can be referred to, yeah, 17025 for non-human, 15189 for human, and for R&D, human is ICHGCP, and for non-human, it will be OECD GLP number 1, and also the test guideline. Yeah, TG is the test guideline or the protocol that's used, yeah, to conduct the safety studies. And finally is the special lab that we have 3 just now that I've shared 3. Maybe based on your experience, you have more, but this is what I can gather for this session. So for proficiency testing lab, so we call 1743, reference material production is the 1734, and the metrological laboratory, if they are testing lab, they can also comply with 17025, but if they are a national metrology laboratory, then they will make reference to the OIML. Yeah. So my last slide would be the monitoring bodies and also recognition. So if you can see based on this schedule or this so-called Gantt chart or whatever you call it, so we can see here, so these are the standards that's been used, okay, and this would be the responsible body that is that is involved. Yeah, for example, here we have a responsible body to monitor. So as accreditation body, that's called an accreditation body. So it can be government and it can be also private companies. Yeah? For example, in Malaysia, we only have government. So that's Indonesia. But if we have participants from Vietnam, they have both government and private accreditation body. Philippines, they only have Philippines and Brunei, they only have government. Okay, so it depends on the structure of the country. Okay, whereas for the GLP, the responsible body for monitoring is called a compliance monitoring authority, and it has to be a government body. It cannot be a private. So for Malaysia, we have Department of Standards Malaysia, and we have also NPRA, which is the National Pharmaceutical Regulatory Agency, that is been appointed by the cabinet as the CMA, the Compliance Monitoring Authority. And under the ICH GCP, the responsible body are the regulatory body who is looking after making sure this is compliance. So for Malaysia, it will be the NPRA, and the rest I show here is USFDA, EMA. Yeah, EMA is the European medical agency. And finally is metrological, is the National Metrological Institute or Laboratory. Yeah. And in terms of recognition, if for the accreditation body is under the ILAC, APEC, ILAC, MRA, which is Mutual Recognition Arrangement. If it's for the GLP, the recognition is under OECD, Mutual Acceptance of Data. And for GCP, it will be by the regulatory authority. Yeah, that's been assigned for the country. And finally is the metrological lab. They have to comply, or they will be monitored under the either the accreditation body if they are accredited, or whatever they implement is complying to the OIML. So that would be my last word for the sharing. And thank you very much to all that has attended, because I was also asked to give a bit of time for Q&A. So that would be my last slide. Thank you.
Right. Okay. Thank you so much, Wan Fariza, for that very insightful and comprehensive presentation. And I think we can see your deep understanding in the accreditation and the management systems of the laboratory in ensuring that the lab operation is adherence to the standards. And now we can reopen the floor to Q&A sessions. If you have any questions, you can ask in the chat box. Okay, we have the first questions from Fariza. Hi, madam. CRIM will be complying with standards?
Okay, so as I mentioned, so CRIM is the special lab, which is the third type, which I have put in here. They are the metrological labs. So if they are going to be accredited, so they will be accredited under 17025 and by the accreditation body, and their compliance is also being monitored under the OIML. Yeah, as I mentioned, there is a few series of documents, and one of the OIML is the one that is make reference to the metrological institute or laboratory of the country.
Okay, and I also would like to refer to your last slide on the monitoring bodies and recognitions, and where do DOSH comes in the application of the standards department?
Okay.
Yeah.
All right, so we have to, before we decide which standards is applicable, we need to see the function. Okay, so if DOSH is running a testing and they want their operation in testing is to be accredited, so it will be 17025. All right, and what else does DOSH do? Because DOSH is more as a regulatory authority. Okay, so they are making sure that the occupational health and safety is being conformed by companies, the manufacturers that is dealing with any chemicals. So I would say any of the lab or any testing that has been conducted for normal testing, which is non-human, it will be 17025. Okay.
Thank you, Fariza. Next question. Is there any proficient testing lab in Malaysia? What is the requirement for proficiency lab to be established? Either must be a commercial or public entity. Does any entity in Malaysia has the reputation and opportunity to establish and sustain the PT service?
Okay, may I know this is from Malaysia or from overseas?
This is from Malaysia.
Oh, from Malaysia. Okay.
Mr. Zakwan.
Yeah?
From Mr. Zakwan.
Oh, Mr. Zakwan. Okay. So for PT or EQA, so in Malaysia, we have four, I think now five accredited PT provider, but among the five is only one that is for 15189, medical, and the rest are all the testing, the non-human PT provider, which, for example, we have Jabatan Kimia, Malaysia, Department of Chemistry. We have also the rubber. We also have, I think, two private lab, that is been accredited under 1743. And for medical, the public health, the National Public Health Lab, MKAK Sungai Buloh, is accredited for medical PT or EQA provider. Okay, so I think that's two which I can catch from the question. So it can be both government and private. So what else was the question? Anything that I left out? Tak sempat nak tulis tadi.
I think that's about it all.
Okay. All right. So 1743. And if, because EQA or PT is very expensive. So if, laboratories that is attending this session have the capability to be a PT provider, so you are most welcome, and you have to be trained against 1743. And we have a scheme called MyPTP in Standards Malaysia or in JSM. We have also the PT policies, MyPTP policies and specific criteria to be complied by a PT provider who wish to be accredited against 1743. So that can also be found in our website.
Okay, thank you so much, Fariza, for the answers. I didn't see any more questions. Maybe I can ask one more question. I think, Fariza, you have been going to audit so many labs and looking at so many situations in the lab. And in your point of view, what are actually the biggest challenge actually for all the labs to adhere to the standards?
Okay. So talking about challenge, so we have to go back to the purpose of accreditation, okay? Because when we conduct accreditation, we will be looking at two components, which is competency and compliance, all right? So in order to comply, in both of elements, compliance and also competence, the first thing is they have to be trained and they have to understand what is the requirement that has been put into the standards, all right? So when they understood, then only they will be able to know what is the implementation, So in my training, I always say when you do a QMS or MS, management system, you must have these four elements, which is EDIM, establish, develop, implement, and maintain. So if these 4 elements is not being understood, is not being implemented and maintained, it will be issue on the compliances. All right. 2 is talking about the competency, because accreditation, you have to look into competency, and competency will be involved into personnel competency, yeah, in terms of how does the equipment performance been checked, is it been verified, yeah, making sure the environment is correct. So all this will actually give an impact to the accreditation or to the system that is being implemented. So based on my experience conducting assessment, so for accreditation, we call assessment. Yeah. For certification, we call audits. So it's different terminology, because assessment will look into accreditation and competence, whereas audit will be looking into compliance only. All right. So you need to define this correctly. If not, you will go to a different system. Okay. So if you're talking about assessment, so we have to ensure the lab comply and competent. So the biggest challenge here is making sure that everything is in place according to the standards. Document is being established, it's been documented, implemented, and maintained. A human is being trained, yeah, and deemed competent and authorized. Okay, equipment is being under the proper maintenance, and also method that is being used are to be verified. So in short, I would say the challenge of having or putting a system, you have to ensure that the MED, yeah, the 3M, 1E, and 1D, which is man, yeah, man, machine, method, environment, and documentation are being consistently under operation and updated. So this would be the among common findings in the lab, where these 3M, 1E, and 1D are not consistently operated. So I think that would be, although the answer is wide, but I can't pin into one issues, because usually in different assessment you will see different issues. But I would say the 3M, 1E, and 1D are the common areas of non-conformity, which is always a challenge, yeah, to the lab to maintain and sustain. Yeah.
Okay. I think that's also include all the tips on how to establish a good lab and follow the good standards. And I think we need to look back on this presentation to catch up all the important notes. And we have one more question. In your opinion, Madam, how can we ensure our organization take in accreditation or ISO as a norm in their setting?
How? The question is how?
Yes.
Okay. So how is very subjective. All right. So I would say that you have to look into first is the function. Okay. What is your objective of having a laboratory? Yeah. What is your objective of the service? Okay. 2 is making sure that you comply to the stakeholder. So now who is the stakeholder? The client, yeah, the customer, the patient, yeah, the regulatory authority. So this would be the second point of how can be achieved. Yeah. Thirdly is making sure also, as I mentioned, the infrastructure of the lab, yeah, that is being established, that has to be maintained. So this would be the 3 points I could see how can be answered depending on the function of your services. who are your stakeholder and what system you are choosing. Because based on this last slide, there are several responsible body, yeah, that is monitoring your implementation. So you need to understand that in order for you to have a system in place that is so-called complying. Yeah.
Yeah, I think when we do, the person who asking these questions, maybe they know the challenges that the lab has to maintain the document is very difficult. So yeah, you know, as what Puan Fariza said, you need to know the functions of the lab and your clients in order to give the best service for them.
I would like to add in a bit, Shami.
Yeah, please.
Yeah, I think in order for you to comply, you have to understand what is the requirement of the standards. Yeah, document or clause number 8.3. Yeah, most of the document is now 8.3 is talking about how do you control and you manage your documentation. Yeah, if that is going to be your challenge, so you have to understand. If you just read through but you do not understand the right concern of what is being written as a requirement, you might not achieve. Yeah. And whoever that has been given the responsibility as a document control and the whole lab also need to understand why you need to comply. Because all the requirement that is in the standards, be it ISO, GLP, GCP, all comes with a concern. Okay, so there is a objective behind, there is a reason behind why such requirement is being included in the standards. Thank you.
Thank you. I think that also one of the challenges actually to understand, to like really fully understand the standards. Sometimes the words can be in a different meaning to a different person who's reading it. So
you're right.
we need to refer to the expert. That's why the assessment is being carried out in the lab regularly. One more question from Mr. Zakwan. Does MDA, which doing medical devices regulatory monitored under which international regulatory or accreditation bodies for medical devices?
Okay. A good question here, because this is also a subjective. Because MDA is a regulator, all right? So yes, usually a regulator, they will act against the regulation, against the act that is being established within their function, all right? So in general, yeah, for a medical device, whatever that has been produced is supposed to be referring to a system that is ISO 13485. Okay, so that is the ISO management system for medical device organization. So if that would be the first requirement, yeah, for all the manufacturer of medical device, so at least that would be the first part of compliance. Secondly, it will be if, because medical device definition is very, very wide in Malaysia. Yeah. But if you look into other countries, they have a bit screwed down a definition for medical devices. But for Malaysia, is very wide. So in terms of compliance, is really huge to look at. So I'm not really sure who is monitoring MDA, but I can assure you, based on the act, based on the regulation that they are having, because when you have an act and regulation is under the country's obligation, yeah, that has to be looked into. And I'm also have an understanding that they also have a surveillance, yeah, market surveillance that's been conducted regularly. So I don't have that much info, but that is the little info that I have related to MDA. Okay? And I'm not sure if this is also focusing on the test kit evaluation. Yeah, so they are also doing that for test kit evaluation, and they are also appointing a lab to conduct such testing. So that's my little knowledge on MDA. Thank you.
Thank you, Fariza. So I think that was the last questions in our chat box. Um, I will finish the Q&A session with the last question from me, because I think we need to clear also on this matter. Sometimes when we do assessment in the lab, the management always freak out when we receive a lot of NCR or observation from the auditor. So maybe from your point of view, or maybe you can give some insight to people out there. Does actually NCR, like the number of the NCR, really represent the quality of the lab? Or maybe you can give something on that before we end the session.
Okay, so looking at number of non-conformity, or in short we call NCR, you should not take number of NCR as a punishment. Yeah, you should look into more of opportunities for improvement, and because you are the one who is doing it day to day, you might not see. So that's why having a third eye to look into your operation would be the best to see your performance. Okay, so based on the requirement of the standards, the management has to understand that the number of NCR is not a punishment, is not something that is wrong, yeah, but it always a ways to improve things. And number of NCR will be usually what shall I say? It usually change the number. Sometimes you'll see more, sometimes you'll see less, depending on the situation of the lab. So if the lab is going through the first step of accreditation, you will see a lot of findings, because that is the first time when a third eye is looking into your system, which usually lab do not realize that something is not correct somewhere. All right. So in Malaysia, we have pre-assessment and then we have compliance. So for a new lab, they have to go through pre-assessment, which usually there will be a lot of findings, because if the lab, if a lab is a very complex lab where we have like 4 to 8 technical assessors, so everybody will go into their respective areas or technical discipline to look into the implementation step by step. So here, the function is to look into the whole operation of the lab. So don't be sad or demotivated when you have a lot of NCR during your early stage, okay? But after you've been accredited, let's say surveillance 1, 2, 3, and reassessment, if the number keep on changing, if the number keep on increasing, the finding it keep on increasing, there must be something wrong. Usually is the understanding against the standards, or the understanding of the QMS or the management system of the lab itself. Okay, so this is where the word of EDIM, yeah, maintain, has implement and maintain has to be always in place, yeah, making sure that before you implement, it's been understood, yeah, they have correct advice, they have been guided properly, they have been told what form to be used, what shows obsolete form, what shows an active form, and etc. So these are the things which sometimes laboratory personnel take for granted. So whatever is on the table, you can just use. But sometimes it's a mix. Yeah? If it's not been controlled properly between the obsolete and the active documents, which can further make mistake in terms of progressing in the laboratory operation. So you should not be demotivated with NCR. Okay, so most of the lab which are positive, they are very happy when we say we have NC. If we say we don't have NC, they keep on asking, are you sure we are? Okay. All right, so I think that's it. Hopefully that answers and give you a bit of a view or perspective how that can be controlled.
Okay, thank you so much, Puan Fariza. I think we really need to listen to that answers, and we're glad that you answers that questions in that manner, because yes, I agree with that. And we have more questions in the chat box. I think the following question we will answer it through emails. Is that okay, Puan Fariza?
Through email, how many do you have?
We have 2 more questions, or do you want to address it now? Or
I think I should just address it now. Is that possible for you to wait another like 10 minutes?
yeah, we are okay. So the next question is, hi, thank you for the opportunity. My name is Ka Ferdinandus from Patimura University, Mukas, Indonesia. I want to ask for you, are there any sanctions if a laboratory is accredited, but during periodic monitoring or audits, there are discrepancies in the test result issued?
Okay, so we need to look. Thank you. Siapa nama tadi?
Meski Ferdinandus from Indonesia.
Okay. In short, Freddy, ke?
Meski, maybe we can call him Meski.
Meski, okay. So sanction and also in terms of results. So we have to look back again. Result is what results? Is it result that is really giving a big impact, a serious impact? For example, if we are looking into a medical lab where the result is wrong, the results are fraudulent, that will be really a serious matter, which we have to take a serious action. If a lab is doing such fraudulent results, so the lab will be suspended. Okay, but if we have the other scenario where lab is being wrongly keyed in and etc., and usually a laboratory will have, or standard have, a procedure to make amendments to the result or revise results with a justification. Okay, what is the problem and who can manage this changes? So this is been written clearly if we are talking about 15189, because it's patient care and it's very serious. So you will see this under clause 7.4 for amendment of results. And then in terms, when you have amended result, there must be a procedure how this is done. What is the identity of the results? Why this has been changed? Who can change result? Then it can also relates to the LIS, the Laboratory Information System. Who can make changes to the result that has already been keyed into the system? So there's also an authorization here. So very serious issue. So in short, we have to look into the results that's been produced. If it's like just monitoring of some evaluation of food, that is not critical. Maybe it's not that critical like a patient result that's wrong. So the process, but when you have a system like 17025 or 15189, there is a requirement in the standards that you must have a procedure when you want to make changes to the result, especially those that have a high impact to the stakeholder, be it the industry or be it the patient and etc. Okay, so I hope that would be clear to our first question. The second question, Chairman?
The second question is Is there any standard for teaching laboratories, for example, in universities?
Teaching laboratories, yeah? So now when you say teaching laboratories, which means it's not involved testing, right? It's more on teaching standards. So if in Malaysia, ni daripada Malaysia ke? The question is it?
This is from Indonesia.
Indonesia, all right.
Yeah.
For Malaysia, we have an organization called the Malaysian MQA, Malaysian Qualification, or I can't remember, that's MQA, that is doing the accreditation of the syllabus of university. Okay, so they will be going around doing a surveillance or monitoring of all universities, and whichever university that has not obtained the MQA certification, they might not be recognized by the government. So that is what is happening in Malaysia. But I think ISO has come up with one standard. I can't remember the number. Not that long, but quite recent. A standard. I can't remember the number.
14,000?
No, 14,000 is for EMS, which is environmental, but this is a system for education, for teaching.
Okay.
Okay, and even they also have a new management system for hospital now. So the two standards came in, I think, quite in a near duration. But I can't remember the number because we don't use that standard. Okay, so siapa yang bertanya tadi?
Tia Amina.
Tia Amina. So Tia Amina, you can actually go into ISO website. Yeah, you can search for teaching standards. Yeah.
All right. Okay. Thank you so much, Puan Fariza, for the answer. It has been incredibly engaging and informative session. Once again, a huge thank you to Puan Fariza binti Wan Abdullah for sharing her vast knowledge and experience with us today. Your contribution to laboratory accreditation and standardization are truly appreciated, and we appreciate the time and effort you have been taken to give this talk. To all our participants, thank you for joining. We hope today's session has provided you with valuable insight that you can apply in your own work. If you found this session beneficial, don't forget to share your feedback and stay tuned for our upcoming webinars. With that, let's give a virtual round of applause to Puan Fariza. Thank you once again, and we look forward to seeing you at our next session. Have a great day. Thank you, Puan Fariza.
Kita tak ambil gambar ke Syami? Tak boleh
Cik Zakwan, kita nak takat gambar, boleh tak? Can we take some photos? Everyone, you can turn on your cameras. Maybe Mr. Zakwan can assist to take photos. Thank you for, we have participants from Indonesia. Thank you for joining. You can turn on your camera. We will take a photo shortly. So, are we ready, Mr. Zakwan? Is Mr. Zakwan on the line? I'm not sure. Tak ada eh? Oh, okay. Okay, Mr. Zakwan has taken the picture, I guess, from the chat box.
Alright.
Alright, thank you so much, Puan Fariza.
Sama, terima kasih semua. Selamat berpuasa and have a good weekend.
Yep. Thank you.
Welcome, Syahmi, Cik Zakwan, and all participants. Yeah, hopefully the little knowledge of me able for you to understand more on management system of the laboratory. So thank you very much. So boleh undur diri ke? Urus
Boleh.
dia nak jumpa sekejap.
I think boleh kot. Boleh keluar je.
Sama Puan Yeni. Terima kasih semua. Okey, Assalamualaikum.
Waalaikumsalam Puan.
Nanti share dengan saya gambar ya.
Okey.